You're listening to the City of Abilene's podcast, Building Community Together.
Hey, everyone. Thank you for being with us here for the City of Abilene podcast as we cover a whole array of topics as they intersect with the city and what our staff and personnel and subject matter experts do in terms of the city and what's going on out in our community and how we can be helpful to you as well. We've got a fun one here today. I am visiting with Talon Bays. She's a registered nurse with the Public Health District and specifically working out of Mercy Clinic that serves women in a lot of the services you do. Right now, you guys are located at the Public Health District off of North 6 because there's a little
leak in the old building. Yep.
But normally you guys would get back over to the Shelton Street location here once that's cleared up. But thank you for being with us.
Yeah, I'm happy to be here. I'm happy to talk about all the things.
I know. I love talking with you in this last year as we were getting the word out a little bit about a sexually transmitted infection, which I'll take one little second now just to preface for everyone to know. We're going to talk about some mature content, but I assure you, this is a city. We'll keep it all very
keep it all very PG.
Super PG. And I'll say this. I was thinking about how to as far as terms and all that go, of course, be very, very professional and all these things. But I have a 12-year-old, an 8-year-old, and a 3-year-old. So that is 12 years of high school football coming my way.
Yes, it is.
So I know I won't say anything that I wouldn't feel comfortable with any of my kids hearing if you might be listening in the radio on the way to our podcast, on the way to work or something here. But with that being said, that I wanted to talk to you because as we first met, you do handle a lot of the interaction with the community surrounding sexually transmitted infections.
Yes, that's very proper.
STI.
Yes.
First, tell us about that.
So pretty much here at the Public Health Department, we kind of have an array of things that we do, things that we take care of. We have two different subsets within the Mercy building. So we have a women's health clinic, and then we also have an STI clinic, so sexually transmitted infections clinic. A lot of the same things happen between the two clinics, except for over in the STI world, I am not doing women's health, like breast checks, pap smears, that kind of thing. But we certainly have those things available in the women's health clinic. So I always love to shout them out too, because we do a lot of the same stuff. But over in the STI clinic, anytime people are just needing a checkup or something's going on, they head over to me and we get them all tested and treated and whatever they need.
Well, and so that came up, last year, I want to say it was like March, April, where you all were seeing an increase in syphilis.
Yes.
So there's a lot of education because I know myself, I never register syphilis as something I need to worry about.
Syphilis is kind of our new kid on the block, not in the sense of it's been around for a long time, but more in the sense that it is like coming in strong. So some new research, actually, we don't have all of our statistics back for 2023, but some research from 2024, 2022, there's actually been a 5-fold increase in the rate of syphilis in Texas alone since 2013 to 2022, which is just a huge jump. And I can attest to that here in Taylor County. We are seeing syphilis at really high rates that we've never seen it before. And so that's just unfortunately kind of how STIs work. When something is happening and it's out there, it just goes and goes and goes and goes. And a lot of people aren't familiar with syphilis because it's not, the traditional chlamydia, gonorrhea, things like that.
Yes.
So I always kind of try to warn people, because the other thing I don't love about syphilis is it's a little bit sneaky. So sometimes the symptoms of syphilis are hard to catch. But just to break it down really easy, if you're having like a sore on your genitals anywhere or a really, really bad rash on your body, just go ahead and get that checked out and make sure that's not anything. I always try to tell my peeps, I'm not trying to freak you out. Not every rash in the world means that you have syphilis, but just make sure that it's not something that you need to get taken care of.
Yeah. And I do recall y'all talking about how it is fully treatable.
Yes, I love that. That's my favorite part about syphilis. It is completely treatable. We need to give you a little medicine, treat your partners, and then we can totally get you taken care of.
And is that something, if you've had the same partner and you're 100% sure that y'all are exclusive with each other, is there a concern about keeping an eye out for this? I mean, this is fully just, as you say, STI, sexually transmitted.
Oh, yeah. So that's a tricky question because it kind of just depends on what has happened in your life. One interesting thing about just kind of STIs in general is when you go through a pregnancy, you
Mm,
actually get tested for STIs 3 times during that pregnancy.
okay.
So most people actually, that is when they get their STI checks in life. So if you've had a baby recently and you're in a monogamous relationship and you know that nobody's stepping outside of those boundaries, you probably don't need to be worried about these kind of things.
Mm,
If you're thinking to yourself, well, I haven't been tested in 20 years because I haven't had a baby in 20 years, and you know things have gone outside of those boundaries, or maybe you just want to make sure, it's never a bad idea to get tested.
got it.
My general rule of thumb, which is what I tell all my peeps, is if you're sexually active, you should get tested at least once a year, especially if you have multiple partners.
Okay.
That's just kind of my spiel on that.
There you go.
Yeah.
You just take that for what you need to take that for.
Take that for what you need to take it for, because a lot happens in 10 years. So if you've had more than one partner in that time frame and you've never gotten tested, it's probably not a bad idea, because syphilis can hide and hang out for a while and not show any signs or symptoms. Once that rash is gone, it's hiding, and at that point, and on average it actually takes 10 years before it shows itself again. And when it does show itself again, it's not good. It's
Okay.
either doing damage to the brain, the heart, just the body in general. So, if you feel like you're in that category, I would definitely recommend just getting a
Yes.
quick test. And easy fix. We can get you medicine and get you taken care of.
All right.
So,
Totally treatable, but the other side is if you haven't treated it, it's bad news.
it's bad news if it goes on long enough.
Okay.
Yeah, it can definitely cause some really serious damage to the body without being treated.
Okay.
Yeah.
What I found fascinating when I first got to talk to you and Dr. Goodnight, rest in peace. He
Yes,
did pass
yes.
this last year and we lost him, but I had a great conversation with him about what has changed. I grew up in the 90s. I was born 81. So as I grew up, the AIDS conversation and the
Yeah.
education was a very big piece of what we
Yep.
were getting. And then, great news is that for AIDS, HIV, it's come out of under control.
Right. Yeah.
But I hadn't thought about the fact of how without that piece to
Piece of
it,
it.
there's a lot less
Yeah.
education just sort of floating around. And then even for me, someone maybe, for example, my age, that there was so much focus on AIDS and HIV, we really didn't think a whole lot about all the other stuff out
All the other
there. And
stuff.
so
Yeah.
there's quite a bit of a knowledge gap out
Yeah,
there.
absolutely. And I definitely see that. So one of the things I get to do with my job is I go out to the high schools and I teach sex education to those kiddos. And there are some really scary education gaps that are happening. Just trying to find the right line of, we don't want to introduce something to these children that they're not ready to learn, but we also want to make sure that we're giving them the tools they need to be able to make the right decisions in their life. And that's a really hard place to be, especially, in a place like Abilene, Texas, because we want to do the right thing, but we also want to make sure we're teaching these kids what they need to know. And so the education has been an interesting part of it, just trying to figure out exactly what the right thing to teach these kids is. And the interesting thing about the HIV AIDS is it is in a place where I think that people would consider it under control. We do have HIV here in our community in Abilene, but I have definitely seen small numbers is really the best way I can describe it. It's just very small numbers, which is good because we have such great and incredible medications that can keep people from transmitting it. So that's really the best part. And just like you said, sometimes once something big as HIV gets put into its box and it's under control, now we need to focus on teaching these kids about some other things. And, just for an example, one thing I see a lot is a big lack of education in herpes education. So I have a lot of kiddos that come and see me and they're experiencing herpes outbreak and they're just really confused. And it turns out that a lot of these kids are getting genital herpes because we're having oral sex with cold sores on our lips.
Okay.
And a lot of our kiddos don't know that is a way that transmits. And even some adults don't know that either.
Yes.
And so that's a big talking point that I always kind of try to add because, and you just have to be careful. If you get cold sores, you just need to be aware. You need to be careful and do the things that you need to do and, communicate with your partner.
Yeah.
But when things are hot and heavy and you're 15 years, 16 years old, you never know what's going to happen. So,
Yes.
yeah.
And then obviously, the big P word, pregnancy is the main concern.
Oh, absolutely.
I know for me growing up, that was like, whoa.
Yes, definitely.
And so They're not thinking about this other stuff. And I think that's a safer alternative if you're concerned about pregnancy.
Oh, for sure. And yeah, sometimes, it's so funny. I live in my little STI world that sometimes I forget about how important pregnancy is too. And that's why I love shouting out our women's health clinic, because we can get anybody that needs to be started on birth control, or, mamas, if you're just worried and you think that I don't want my baby having a baby yet, you can give us a call and we can definitely get them taken care of and get them the birth control that they need to get started. And that'll actually just include an STI check, because that's just kind of how it goes.
Yeah.
So 2 worries and 1 visit on that.
Yeah. And so you've led perfectly into what really a lot of the reason to talk to you at this point in time was that we are going to the summer months.
Yes.
We are going. And then even like we're talking about as we grow back into getting back into school, whether you have like true teenagers or maybe older teenagers who are going to be going off to college, there's a lot to cover. There's a lot of time on their hands. And then there's a lot of new people to meet, and there's things that happen. So just the best knowledge. I mean, what I do like hearing from you, and again, like I said, my oldest is 12, so wanting to be realistic about what happens out there. Of course, you're teaching at home as much as you can, but you do see that people kids from all places and spaces do interact with you.
Oh yeah, absolutely. We see pretty much anywhere about 13 above is what we see here in the clinic. I certainly see a larger number of our college students. Whenever those kiddos start school in August, and just like you said, they are meeting new people, a lot of new things are happening, and sometimes new experiences. And so I always just recommend, like I said, if you're having sex or you've had multiple partners, just to go ahead and get yourself tested. I love it when people come and get tested before they go out and do whatever they're going to do. I just think that makes for a healthier community in general. And I appreciate when people do that.
Yeah. Sure. And as maybe as a parent who has a kiddo heading out to their first year or whatnot of school, of college, what should they also, do we need to worry about, like, and you're going to hear here that I obviously have not dived into this personally because I'm not there yet, but like mono and what kind of shots and things like that should they be maybe?
Yeah, definitely. So really the number one thing we want to make sure that kind of age range is getting is the HPV vaccine. So if you have consented to vaccines with your pediatrician, it really should be a standard vaccine that is given. And it's the HPV vaccine is a vaccine that helps prevent against cervical cancer. So it's for males and females. HPV is actually very prevalent, and we see it all day long. And the unfortunate part about HPV is if the body doesn't clear it naturally, which is what happens with most people, it actually can cause different types of cancers. Okay. That includes cervical cancer, anal cancer, oral cancer, and tongue cancer. So pretty much, anywhere that it gets touched, it can cause cancer there. And so the good part about HPV is most people do clear it, but whenever you don't, then we're worrying about, the big scary word cancer. So the HPV vaccine just helps those viruses that cause cancer to not do those things. It helps decrease the rate of that, and then helps your body's natural immunity fight that HPV off. So I definitely would recommend HPV vaccine for, it's actually for anyone. I think the starting age is 13 and then all the way to 45. So even if you feel like you've never had the Gardasil HPV vaccine and you're in your 30s and, this is something that you're worried about, you can still get vaccinated for it.
Okay.
Yeah.
And I'm glad you mentioned too, as far as the oral cancer concern as well, because this again is not something just that girls, parents of daughters should be thinking about.
And it's kind of, there's a lot of advancements being made, but there is a little bit of stuff that's concerning with our males. So particularly right now, we don't have a way to test for HPV in men. So what's happening is we have people coming in and they will have those things like the oral cancer or the throat cancer that's associated with HPV, but there's actually no way for us to test for it to find out if your body is treating that appropriately. So when I hear things like that, of course, we hate that, but it just makes me think vaccination. Let's try to get that HPV vaccine done so we can do everything we can do to try to keep you safe and healthy.
Got it.
Right.
Okay.
And then, luckily we have pap smears for cervical cancer. So recommended to do those every 3 years. And our women's health clinic does those all day long. So if you need a pap smear, you can also come see us.
Oh, fantastic. Well, like you said, that it's certainly a visit to, if maybe your child hasn't aged out of pediatrician, or if they,
Yeah. Mm-hmm.
to just cover all those things, but they can always reach out to
Yeah.
public health department if they would like to
Absolutely.
speak.
And we just make everything really affordable here. We have programs for low-income families, so treatment, testing, all that can be literally as low as $0. A little shout out to the STI clinic. It's actually only $25 to come and see me to be tested and treated. And we do have some programs if you're not able to afford that. Yeah. So
Yeah.
definitely should
Okay.
come see us.
And like you were saying too, I know you guys work to always be very mindful of parents want when it comes to
Yeah,
maybe younger person and
absolutely.
all that, but you can reach out and talk to someone there, regardless of age.
Yeah, regardless of age, if you have some questions or, maybe you're just a little too worried to talk to mom or dad, you can always holler at us. It's always going to be our support. It's really good to have supporting people around you, and it's understandable that you might be afraid that someone's going to get upset or mad at you, but I'm always going to encourage that you have a support person with you. But if you don't feel like you can go there, you can always give us a call and just ask as many questions as you need.
All right. I'm just going to go ahead and of course I'm not quite there, but I'm going to give them your number, Talon, because
Yeah,
I find comfort because I know all the things I did not talk to my mom and dad about.
I know. Same.
I
I'm
still
thinking
don't.
the exact same thing.
No, mom, we're not, let's not.
I know.
And it's completely understandable. So yeah, to have that person that you feel like you can confide in
Yeah.
and get correct information.
Correct information is a good point because, our best friend may not always know exactly what's true and correct.
I mean, TikTok, what the kids
Oh,
doing
yeah.
in social. I mean, I can only
Yeah.
imagine.
Yeah,
There
for
we go.
sure. So our phone number is 676-6634. And we got good people working on the phone. So if you need anything, you can get in contact with them and they can get you in contact with me.
Awesome.
And then just a couple little pointers. I did want to mention that here at the Public Health Department, we have a couple of things. You can always come in and get free condoms. A lot of people don't know that. We've got free condoms here at the front. And then we also have free Narcan at the front as well right now. So if your summer isn't going to include things like that, you may want to stop by and see us.
Yes, there we go. Well, thank you all for what you do. I know it's a
Thank
hard job.
you.
And being there for our community. And again, if you have any questions there, like you said, just give them a call.
Yep, give me a call. I'll be happy to help.
Yay. Have a wonderful summer. Maybe don't make it too hot.
Yep,
Not
don't
too
make it
hot
too
and spicy.
hot.
Less spicy is better. Thank you so much, Talon. I appreciate
Yes,
it.
thank you.
Oh, awesome. And if you ever have any questions, again, if you just go to Abilene-TX.gov, you can see their under departments where you'll find public health. And of course, they can help you with all sorts of health questions that you might have. If you have any particular questions about maybe women's health or STIs and just getting armed with the right information, just give them a holler and they are there to help. So thank you again. And again, it's Abilene-TX.gov.